Hello colleagues and classmates, this is Lindsay. I'm going to go over a little PowerPoint presentation here regarding simulation in nursing education. I know we've done some readings about that in class up to this point, and some of you took the class with me last summer with Dr. Harmer that went into simulation even deeper. I'm just going to go over a few of the topics here related to simulation in this presentation. So the outline of what I'm going to go over tonight is some of the history of simulations, the benefits and significance, particularly as it pertains to nursing education, some of the limitations that make simulation somewhat difficult in certain instances, some of the desired outcomes for the simulations within nursing education, and then how we measure the success of the simulations that we're doing for our students. Also, I wrap up with just a little bit about how simulation will affect my future practice as a FNP-DNP. As far as the history of simulation, it was first utilized, not sure what that was, hopefully you didn't see that, but anyway, simulation originally got introduced in the 1960s when mannequins such as the Recessa Annie was developed to train cardiology professionals. Advancements in simulation continued, and even the United States military, aviators, and medical professionals were using simulation by the 1980s. The introduction of affordable, portable, and versatile human patient simulators in the 1990s actually transformed healthcare, education, and the technology of the future for competency testing and continued education. That's a quote there from a textbook I used. Some examples of simulation are using standardized patients, mannequins, and some simulation centers. There's a photo here I'm showing that I found online of a student. They're utilizing moulage, which is like a form of makeup to simulate injuries. In this case, looks like blood and abrasions, to help nursing students get a visual representation of the condition they're looking to assess as part of the simulation. Simulation in nursing education is a growing trend as the discipline seeks to advance nursing practice and educate nurses to keep up with the evolving demands of healthcare delivery. Like I said, standardized patients, mannequins, and simulation centers aid in delivering high-fidelity simulation to nursing students. It allows educators to place students in healthcare situations such as resuscitations or critical events that they may not have had the opportunity to be a part of in the real world. The simulation in general allows students to practice critical thinking skills, make mistakes, work collaboratively with other students, and develop a better understanding of the learning objectives as outlined by the educators, and it's all done within a safe environment. Students can gain an even better understanding of the simulation's learning objectives in debriefing sessions. Many of you who've participated in simulations may remember the debriefing most because that's where a lot of the learning does occur, as shown in some of the studies I cite later on. Educators get to critique the students' performances during the simulation in the debriefing that follows, and I'll talk a little bit more about that coming up. As far as benefits of simulation go, there are quite a few cited in literature. Simulation offers healthcare educators a medium in which a wide range of experiences can be provided to learners in instances that are either too rare or too risky for novices to engage in a clinical setting. If you think about a real-world setting, you aren't often going to find a novice nurse taking care of critical patients confidently unless they've developed those skills. Learners are able to practice, learn, make mistakes, and evaluate learning without the risk of harming real individuals. That kind of goes without saying. One of the sources I looked at was an article by Galloway where it links Benner's theory of clinical expertise on a continuum of learning knowledge. This continuum spans from a novice to an expert, Galloway discussed how simulation can be beneficial in narrowing the gap between novice and expert, between the formal education and the clinical expertise. Furthermore, she states that it is the role of the nurse educator to facilitate learning that is based in the theoretical underpinnings inherent to nursing, but is linked to clinical expertise that make up the foundation of nursing knowledge. So she's saying essentially that simulation does play a big role in the development of nursing expertise. Another advantage to using simulation in education is that it can actually be utilized in current nurses' practice as far as continuing education. Simulation in nursing education has another major advantage that I sort of alluded to earlier, but that simulated patients is one example of how we can create real-life situations. It allows learners to react as though the situation was real, gaining a better understanding of their communication skills, clinical strengths and weaknesses, potential biases, and their reactions to stressful situations. So oftentimes with simulated patients, an actual human would be playing the role with role cards, a little history, and sort of acting things out, and they can in the moment respond to the nursing students' interventions. As far as those are helpful often in like mental health patients, for example, who can carry on conversations and sort of direct the student into their interventions appropriate for the patient. Also, utilizing simulation allows instructors to step in, correct, and control the situation when things are, going away from where the learning objectives were established, or if there's a teaching point, they can stop the simulation, utilize that moment, and continue on. Galloway again, she calls for a full mission simulation, in quotes, which is basically a multidisciplinary team of healthcare providers that are involved in the simulation of a complex patient situation. She talked about using mannequins for this, especially in the undergraduate setting. Multiple disciplinary care again mimics the real life situations that we would like to have our nursing students get familiar with before they enter the healthcare settings. Again, debriefing is beneficial, where the learner and the instructor has the opportunity to discuss the simulation, going over the learning objectives, review what went well and areas for improvements. Sometimes in a reflective practice, the instructor and the students can better understand their decision making and the instructor could find ways to improve the simulation based on feedback they received from nursing students following the simulation in a debriefing session. Debriefing has been described as the linchpin to successful high-fidelity simulation. Awareness of one's thinking may be the first step in improving critical thinking in a debriefing process whereby students are guided to think cognitively and purposefully about the experience. This is a quote I found in an article related to simulation that really just stresses the importance of the debriefing session and the overall learning and effectiveness of simulations. Some limitations associated with simulation are some of the obvious ones. Most often they're more challenging on the administration part rather than the students. A textbook by Jeffries cites expense, space, computer literacy, and technical support as the greatest limitations in simulation education. Faculty time commitments to simulation and additional research to support the use are added challenges. It does take quite a bit of time on the part of the educator because the use of simulation involves a paradigm shift from the teacher-centered to the learner-centered experience. Learner-centered is a term many of you may be familiar with, but is the trend in nursing education as far as focus. The actual reaction to the scenario itself is only the first step, and educators must also envision and plan for the varied learner responses. So basically, what the textbook was discussing there is that learners have different styles of learning, as we know, and that one of the limitations of simulation as it relates to that is that not all learners will take away the same things from the experience, maybe not exactly the objectives you were hoping to get from the designed simulation. One of the things discussed in the articles I reviewed was the domains of learning. None of this is probably new to graduate students at SVSU, as this seems to be a common thread. There's cognitive, affective, and psychomotor. Cognitive is when we share facts, theories, and concepts. It really involves a lot of intellectual thinking, whereas affective is more the values, beliefs, and behaviors of the individual learners. And then psychomotor is the hands-on learning, where the simulation sort of gets your hands wet, if you say, or your feet wet, I say, get your hands dirty, doing the simulation, doing the tasks. Here's a photo of an instructor operating the computer portion of the simulation, overseeing students at the bedside on a simulated patient there. Here's a quote that sort of talks about the tying in of all of the ways of learning and how simulation can make a difference with that. You can tie all three of those domains of learning together when we do practice delivery in the simulations. So, you know, nothing is no action you perform is not without having learned something, either something you're drawing on from the past or something you're learning as you're doing. So this is a little quote that sort of speaks to that. When we talk about simulation, we do have desired outcomes, and ideally those are measurable. Obviously, the major desired outcomes are that students gain clinical knowledge, practice clinical skills in a safe environment, have the opportunity to make mistakes in a learning setting, and practice interdisciplinary patient care. Quality and safety have always been core nursing values, and simulation helps to support the development of these nursing attributes. The Institute of Medicine actually developed some competencies in an effort to build a safer healthcare system and change our healthcare providers' thinking about patient care and safety issues in regards to quality of care. So they developed this list of competencies measurable by this quality and safety education for nurses. Of course, listed here are the desired competencies, including patient-centered care, teamwork and collaboration, evidence-based practice, quality improvement, safety, and informatics. The knowledge, skills, and attitudes associated with each of these competencies represent core values and concepts for both the pre-license and the graduate nursing curricula. That's again a quote from a textbook of mine regarding the importance of these competencies, and again they're measurable and applicable to simulation. Competencies can be measured pre, intra, and post-simulation. And educators can design and implement simulations that allow students to develop ways in which they learn to think in terms of these measurable outcomes. So always having these things in the forefront of their mind while they're practicing and learning. They pick up those skills in a simulation setting and then apply them at the bedside in real life. Again, stressing debriefing. That's a big portion of this. I found a photograph here where it looks like students are kind of going over things that happened during the simulation in a conference-style setting. Debriefing is the practice in which educators and students have the opportunity to review the simulation, revisit the encounter reflectively, and go over the events and the learning that occurred. Currently in the DNP track, I'm taking Nursing 800, where we spend a lot of our time talking about reflective practice, thinking back on the things, the occurrences of certain events, how you felt about it, how others around you felt about it, things that led you to make the decisions you did. If you think back to those and reflect upon them, they can be really beneficial looking forward and making better decisions in the future, or, sometimes it's a matter of congratulating yourself for having thought that through when others may not have, that sort of thing. So reflective practice is something at the graduate level at SVSU is a common thread as well. But we can kind of sort of introduce that in the simulation setting as far as debriefing goes. Debriefing can be done in groups, as in this photo here. Individuals are kind of one-on-one. Debriefing originally was derived from the military's use of debriefing after important missions, and of course it transpired into the simulations and then into nursing education. Another quote I found, it talks about debriefing, and it said that it has three major purposes: to receive an accounting, to mitigate emotional response, and to correct decisions and reactions that were incorrectly applied in the simulation experience. So debriefing is essential in all types of simulation, whether it be human subjects, avatars, or using mannequins such as SimMan like we have in the SVSU lab. It's critical for facilitating learning, particularly in the areas of cognitive development and decision making. So again, critical thinking is a common thread in nursing education, and this is part of the cognitive development, and can be actively built upon their prior learning and test assumptions about what they know about patient care. I am sort of a unique student in this class, I feel, because myself and Smriti are both in the FNP-DMP track, but we're also pursuing this nursing education portion of our education. Some people may see the hard to find a connection between those two, but as far as going further, forwarding my practice, I will be practicing as a primary care provider, most likely in a rural setting here in Michigan. What I would like to do with simulation is draw upon my past experiences. I was fortunate in my undergraduate degree to be exposed to simulation in the Ferris's lab. They had a simulation lab at Ferris, and us undergraduate students were able to participate in several simulations. Those were experiences that I found valuable to my education, and I apply those principles even now. I think it will be important as I build my practice and my staff that I find staff that also has, first of all, bachelor's prepared registered nurses. I think is going to be important for me, and ideally those who have had experience in simulation in the past, as I feel those skills developed in those settings are really important to a continuing practice, and something I would like to involve in my practice as an FNP. Also, it's frequently simulation is offered within continuing educations, whether it's online learning based or avatar type things, or practice on real life situations where they're mock-ups. Those can be in all levels of nursing, whether it's at the RN level, BSN, or the FNP. So I will seek education opportunities for myself and my staff that will include simulation, because again, I listed the benefits and I feel strongly about its importance in education. And also, despite my being an FNP long term, I do think I will stay active in nursing education, whether it's assisting in the lab or helping to design some curricula for upcoming nursing students at all levels. This class and others, plus simulation, will have prepared me to help prepare upcoming nurses. If you think about us doing nursing education, we're essentially training and teaching our colleagues, our future colleagues, so it's important that we do our best to prepare them the best we can. And I think that will be important in my practice, as far as developing my practice too. So that's the tie-in there. As far as the future of simulation goes, every source I looked at really just cited the need for more research to continue to support the use of simulation. If we can continue to find positive outcomes, measurable successes in simulation, we can continue to sort of vie for these future opportunities to continue to utilize simulation. So always there's a plug for more research needed to support this, so it becomes more of a common practice. As technology advances, we get more and more opportunities to utilize simulation. I have a picture here of basically an avatar situation where there's a nurse and a patient in a computer-based setting, and then interactive learning occurs in a sort of a movie-like setting where the nursing student would control sort of the actions of what's going on through the mouse and the keyboard of a computer. Some of them are voice activated as well, so that's another interesting advancement. As nursing programs become more diverse and we have more online educational opportunities, these simulations may become more and more beneficial. If students are not physically on campus, some of these computer-based learning avatar type simulation settings may be the key to getting people as close to a real-life situation as possible over distance learning. Obviously, as the discipline of nursing grows, we're going to have to grow with it, and as technology improves, we can utilize those improvements to continue nursing education. I found this sort of nursing humor comical shirt. Thought maybe some people would get a laugh out of that. I survived lab, but Sim Man didn't. And here are my references. Thanks for listening to my presentation tonight. I hope you all have a great night.